guys, welcome to my channel. This is actually my first ever vlog, which is both exciting and nerve-wracking at the same time. So for today's video, I'll be talking about my clinical extern interview experience and how I prepared for it, the nursing concepts that I reviewed beforehand, and some tips that helped me feel more confident going into the interview. And before I talk about the interview itself, I kind of want to explain why I applied for the clinical extern role in the first place. Honestly, I really wanted more hands-on experience in a real clinical setting. Never worked in a hospital before, and so there were positions that I was very interested. I applied for PSW, I applied for youth healthcare aid, I also applied for this clinical extern role. In nursing school, we learn so much theory and we have practice skills in labs. We have simulations, we have placements, but I wanted to build more confidence working with patients. I wanted to improve my communication skills in an actual healthcare environment. I wanted to strengthen my nursing fundamentals more. I didn't want to forget them. I want to keep building that, and then just master things in patient safety, infection control, communication, mobility assistance, just recognizing changes in patients, helping them with their ostomy bag, recognizing changes, inputs and outputs, managing behavioral patterns. One thing I realized during nursing school is that sometimes you can learn a skill really well, very well in class, but when it comes to do it in real life, nerves can make you second guess yourself for a moment. And that's why I wanted more exposure, because I believe confidence really comes from repetition and practice. And exposure will definitely help. And it won't feel like such a cold plunge once I become a nurse. So yeah, that's mainly why I applied for the role. I first found out about the position through my college advisor. So I submitted my resume and started applying to other healthcare related positions as well. Yes, so weeks went by and I honestly wasn't hearing back from many places. So I decided to edit and improve my resume. I talked to my peers and they were kind enough to send me their resume, and I noticed that they were really outlining their skills. They were outlining specific skills from different workplaces, so I did that. And yeah, when I look back at my original one, none of that was highlighted, and I didn't even highlight some of the clinical skills that I learned in my clinical placements, like patient care and other experiences. I wasn't doing that clearly enough. I reorganized everything. I added more details about my clinical experiences, work experiences, and made my skills easier to read. I used to have one page, just concise, and then I ended up with two. After everything, I professionally followed up on my application as well. And shortly after that, just within 1 hour, I received an interview invitation. So one thing I learned from that experience is that don't underestimate your resume and don't be afraid to professionally follow up. Make sure your resume clearly highlights your healthcare experiences, your certifications, your clinical skills in a way that's easy to read, because every experience and every facility is different. So they just want to see if you also are capable to perform that specific skill in their facility. After receiving the interview email, they also sent me an interview package, and then I started preparing for possible situations and nursing related questions. On the interview day, I made sure I was early, I was dressed professionally, and I also prepared mentally. Even though I was still nervous inside, I felt more confident because I had reviewed my nursing fundamentals beforehand. And a lot of these questions were centered around the core nursing principles like patient safety, communication, infection control, delegation, privacy, and basically staying within the scope. One thing I noticed is that healthcare interviews often focus less on perfect answers and more on how you think through situations safely and professionally. They're testing you on how you think about certain situations. So being able to be confident and being able to articulate that is a bonus point. I can't fully remember everything they asked me, and even if I did, I am sworn to confidentiality. However, there are common interview questions for roles like this. I even had to do my own research on possible interview questions for extern roles. I was also watching YouTube videos about nursing interviews, extern interviews, etc. When I prepared for it, I pulled up knowledge from my learnings from Perry and Potter, nursing fundamentals, Jarvis health assessments, review a little bit of lifespan development courses for elderly people, which is all tied to fundamentals. For example, I prepared for questions related to confidentiality and privacy. I explained that as a clinical extern, I was saying things like, I understand the importance of staying within my scope. Keywords such as protecting patient information. So situational questions would be like, if a family member asked me for an information, articulating that you are not authorized to give, that you would politely redirect them to their nurse, and to remain respectful and helpful through it all. I also prepared questions related to behavioral situations and therapeutic communication. There's all kinds of scenarios that you could practice. I focus on approaches like staying calm, using a gentle tone, using GPA techniques, avoiding arguments, avoiding harsh language, maintaining patient dignity and safety. Do not be defensive. Just use simple, short, clear communication, and asking help when you need, because maybe your coworker has a different approach. So things like that. And I also reviewed infection control concepts because those are extremely important in healthcare settings. So I reviewed hand hygiene, PPE, isolating precautions, preventing cross-contamination, maintaining safe environment for patients. I reviewed situational questions like, what do you do when the patient is on the floor, things like that. Another topic I prepared for was teamwork and delegation. You need to know what can be delegated, to ask questions if you're unsure, to report abnormal findings. So I reviewed a few of my fundamental skill sets, and just to understand delegated tasks properly, and to stay within your scope and obligations that I need to do as a nursing aide. I also prepared to talk about nursing skills I was comfortable performing from my clinical placements, like vital signs, mobility assistance, ADLs, head-to-toe assessments, intake and output, skin integrity, and patient safety measures. I also remember discussing things like how important it is to reposition patients, to address pressure injury prevention, making sure call bells are within reach. Most of my preparation honestly came from reviewing my nursing fundamentals and practicing situational questions out loud, so my answers would sound natural instead of overly memorizing things. And one thing that really helped me during the interview was remembering to prioritize patient safety, communicate concerns, stay within the scope, ask help when needed. Towards the end of the interview, I also asked questions because I genuinely wanted to learn more about the role. This role is basically very, very new. I wanted to make sure I have learning opportunities, and I wanted to learn a little bit of advanced skills when I have this role. I think that also helps show my interest in growing and learning as a nursing student. Overall, the interview ended up feeling more of a conversation than I expected. Even though the questions were detailed, they really drilled me. Later on, I was told that I performed very well during the interview, which felt really rewarding. So it reminded me that things we study in nursing school really do matter, and they stay with you over time. That's everything I'll share for today. And if you guys want another video, I can also talk about my first week as a clinical extern. If I can't do that, I'll just talk about how it has been so far, what the role is like, and what I learned from the experience, because this is practically very, very new. And so thank you guys so much for hanging out with me today. Thanks for watching. I'll see you in the next vlog as we keep learning one step at a time. Bye-bye.